an 18-year-old young person who came to me with multiple complaints to my clinic. I would like to share that story. He's an engineering student who came to me with complaints of intermittent episodes of pain abdomen. He's been having pain. He's been consulting local physician, and he's been taking some medications, and he's been feeling better for some time. But by the time he came to me, it was like 6 months after the first episode, and he presented with severe pain. So gradual weight loss, he lost at least 10%. He was 60 kgs before he started having these symptoms, and now he came to me with 54. His weight was 54, and he's been experiencing some swelling in his legs. So as he came into my OPD, I observed him, and his age was fitting into something in my mind, which I was thinking called as inflammatory bowel disease because of his symptoms. So when I asked him for some investigations, he was immediately ready to do everything. And we had to do a CT scan, some blood tests, and something called a colonoscopy. And we came to a conclusion that this boy had something called inflammatory bowel disease. So that is the first part of the journey that we made. We came to a conclusion that he had something called inflammatory bowel disease, and we divide that and we labeled him as Crohn's disease. So the next question comes to his mind, and he asked me, what is this Crohn's disease and why did I get this? So when I had to answer him, I would have to take all his history and his dietary history since his childhood. So his family members never had any complaints like this. So there is nothing to be familiar here. But when he gives me his history of dietary intake since his childhood, so all of you here, I know you can relate with him. He's been eating outside every day. He's been having all this junk food every day, and he's in hospital. He's been in the hospital for maybe 3 years already before his engineering also, and most of the time he's been eating outside. This is the only specific history which I could get, and his symptoms are only 6 months old. So then I had to explain him about why this disease is happening and what led him to this condition. Definitely, it's a curable disease. I do agree, but it's a lifelong disease which he has to be being treated for next maybe 5 years or 10 years or maybe lifelong. So most important thing what I had to explain him is, so inflammatory bowel disease is nothing but your immunity. Your body has a fighting capacity and it fights with any organism, any infection which comes into your body, and this system is called immune system. So when your immune system recognizes your normal body part as a foreign organ and it fights against it, this is called autoimmunity. It happens in multiple organs, and when this happens inside your intestine, this leads to this disease called inflammatory bowel disease. And why did it happen? Can we correlate with all these dietary habits and what all the causes? Definitely, yes, I would definitely correlate all these symptoms and this autoimmunity or this IBD to his dietary habits since childhood. So most of the time, your gut has trillions and trillions of good microbiota, good bacteria, multiple organisms. It can be bacteria, fungus, and multiple others which are actually good for your body. So these help in improving your immunity, improving your fighting capacity, helping in digestion of multiple foods what we eat. It helps in multiple things. And now that microbiota is the basis of any disease. If the gut microbiome or your good bacteria is disrupted by any cause, that forms the basis of multiple diseases in your body. It can cause a lot of heart attacks, the young heart attacks what we are seeing these days. It can cause problems to your liver, it can cause fatty liver and so on and so forth. It can cause problems to your mental, your psychological illnesses. This can be the basis. So disruption of gut microbiota is the reason for all your diseases, and in my patient is IBD also. So what causes this gut disruption? That is where I want you to understand. So your gut microbiota is can be enriched every day by the type of food you eat, and it can be disrupted every day by the type of food you eat. This is where your good food or the bad food comes in. What is good for your gut microbiota or microbiome is good food. What is bad should be avoided. And to list few things, I would like to say, please avoid everything which is packed. We call them as processed and ultra processed foods. Please completely avoid them. Stop all your cool drinks or your sugary drinks. This will harm your gut microbiota. So when someone was asking what hurts your gut, anything which hurts your gut microbiota hurts your gut. So avoid those things. Try and avoid eating outside because it has a lot of infections. Try and avoid saturated fat. It can disrupt your gut microbiota. Try and have fresh fruits, fresh vegetables. This will enrich and build more and more good bacteria in your gut. Fresh fruits, fresh vegetables, and lean protein is good for your health. So, if you inculcate these habits since your childhood, your gut microbiota is safe and you are not prone for any of these diseases. So, IBD, definitely it is a treatable disease. You can definitely treat it. I started him on something called biological injections, and it's been last 7 months that I've been seeing him. He has gained his weight back, and he is somewhere around 60 now, and he's doing very well. No pain abdomen, but definitely this boy requires treatment for prolonged period of time, and which I will be monitoring. That's the story what I want to say about your good food and bad food. Differentiate them. When you are eating good food, you are enriching and maintaining your health. You are enriching your gut microbiota, which maintains your multiple health. That's psychological health and your physical health. The second story is about a 34-year-old software guy who came to me with abdominal bloating, swelling in his both lower limbs, and he's been observing some yellowish discoloration of urine when he's passing urine. He also complains of loss of appetite and not able to sleep properly. So we evaluated him, and when we did the basic investigations and an ultrasound abdomen, we found that his liver is cirrhotic. I'll explain what is cirrhosis of liver. And he had fluid in the abdominal cavity. So normally we don't find fluid in the abdominal cavity. We call this as ascites. And because of a lot of fluid, it's been accumulating in his legs also. So this man has been drinking alcohol maybe for the last 10 years, but it was occasional alcohol intake. Occasional in the sense he's been taking alcohol once in a week or twice a week along with his friends, and whenever he takes it was not less than 5 drinks at any point of time. So this man, I could not just categorize him like alcoholic liver disease because occasional alcohol intake over a period of 10 years, and this is not a criteria to label anybody as alcoholic liver disease. And when I asked him about his dietary habits, that is when he revealed he has been having a lot of fatty and junk foods most of the time in his life. Along with alcohol, he's been having most of the time this oily stuff and all those things. And on his, when we examined his lean weight, that is excluding the fluid, whatever he has been already obese. So this man already had some amount of alcohol, and definitely it's not just alcohol liver disease. There is something called non-alcoholic fatty liver which has been developing for the last 5 to 10 years, and over that this alcohol. The combination of alcohol and non-alcoholic fatty liver has caused damage very fast in this body, in this man. By around the 34 years, he has developed cirrhosis. Otherwise, generally, if someone has exclusively non-alcoholic fatty liver disease, we don't see before 45 years of age presenting with cirrhosis. But this man had a combination, and which is a general trend at this point of time in all younger people. I'm seeing a combination of non-alcoholic fatty liver and a fatty liver disease and the alcohol-related fatty liver, which is progressing very faster to a stage called cirrhosis. So our liver is a powerhouse of our body. It actually does some around 600 functions in the body, and when it is getting damaged, it won't give you any symptoms. Only when the symptoms or the liver disease has progressed to the end stage, that is what I'm calling as cirrhosis of liver. The soft liver, which is normally like a sponge, becomes hard like a rock, and all its functions are down. So that is when he presented to us with his swelling in his abdomen and his foot and his feet, and yellowish discoloration of eyes, jaundice because of dysfunction of the liver. So this is the stage where we identified, started him on treatment, but definitely that's not enough. This man has to be followed up. Most of the time, cirrhosis, when it has decompensated in the form of ascites, as I was saying, this patient is in his end stage of liver disease where he may require liver transplantation. We followed him up for next 3 months with medical management, but not much improvement except that fetal edema, that swelling in his legs have improved, but the liver functions were still bad. So we had to suggest him for a liver transplantation. And all of you should understand how much pain it is for the family and the person if someone has to go through a liver transplantation. Liver transplantation is the old liver which has been damaged will be removed and it is replaced by a new liver. So these people, there are a lot of hurdles for a liver transplantation. One is the cost of the procedure itself, the surgery. Second thing, the availability of the organs. It's not easy to get a liver whenever we need. They may have to be listed, and the waiting list will be somewhere around 1.5 years. And we don't know what is going to happen to this person by the time he is waiting for the liver. So these are all the things which people have to make a note. It's very casual for him to have an alcohol once in a week and having this regular fatty food and all these things. So be aware of what you're eating, and it's very casual these days to say once in a while alcohol is okay. But yes, with this combination and with this example, I think all of you will understand. Even once in a while is not okay, and please be careful. Thank you.